Welcome to Breaking the Couch, a weekly conversation demystifying what happens in and behind the therapy scene to support your healing journey. We are your hosts.
I'm Dr. Doughton, a licensed clinical professional counselor, a certified school psychologist, and a trauma specialist with Playfully Psyched.
And I'm Dr. Jo Harchi with Soft Heart Psychology, a licensed clinical psychologist.
We're here aiming to provide you with mental health tools to address the cycle of generational trauma across the age span, from infancy and childhood to adulthood.
For more information, visit our Instagram page at Breaking the Couch or our website, breakingthecouch.com. While we hope you love listening to and learning from our podcast, it's not a substitute for a relationship with a licensed mental health professional. So, Dr. Doughton, I know that we are both excited about this topic today. We want to talk about generational trauma. And you might be like, why are we excited? That's weird. The reason why is because so many things get misunderstood as, I don't know, for example, I'll just say there are times where folks have come to me with this stuck grief, this generational trauma, and they are on an antidepressant for years, and they're wondering why their antidepressant isn't supposedly working. Their antidepressant plus therapy, they're literally following evidence-based treatment. They just are like, what am I missing here?
Mm-hmm.
And when we're able to do that, stepping back, looking at it from that lens of generational trauma, we might see that stuck grief. We might see the trauma. We might see what comes up in people's telomeres and how that presents in their day-to-day. So yeah, that's kind of why we're excited about it, because we get a chance to sort of debunk and kind of see what's back there, not just the thing that they came in with.
Yeah, I think I definitely agree with you. And also, I'm going to take a little bit of a step back just to help people frame and understand generational trauma.
Great.
And
Please
right,
do.
because I think that some people will know, like, oh, yeah. And other people are like, what the heck are they talking about?
Telomeres, what? Right.
Telomeres,
Yeah.
exactly. So kind of thinking about generational trauma, and it'll also be called transgenerational trauma and intergenerational trauma.
That's the one I learned to use, intergenerational trauma. Okay.
Those are all the same, right? And I don't even know why they have different terms. I'm sure there's been some type of, this person said this word and whatever. But those are three terms that pretty much are used interchangeably. And it is to describe It is to describe trauma that is passed down across generations, right? And this can be behaviorally and biologically or genetically. And so what I mean by that is, so if we think of behaviorally, I think that this is probably the point that most people can understand most clearly. And it's that, say, for instance, a grandparent, right, was raised during a wartime, right? And during that wartime, things were scarce, food was scarce, things weren't safe, right? And so they taught their children to restrict food, to ration things out, to stay off, couldn't play outside, right? And they were fearful. So they passed that level of fear down through a behavior. It's like, okay, now this child who's no longer in a wartime, right? Who's now outside is safer, who now maybe has more money. Now they still have they feel like they don't have money. They feel like they're on the edge and they're unsafe, right? Because they passed down that behavior. And then they're going to pass similar behaviors down to their child, right? Almost always is implicit. So without them realizing or knowing that this is why I'm passing this down, or that this is being passed down.
So they're not like meaningfully, intentionally being like, I'm going to make this person scared of money and scared of food. And
exactly. No, not at all. Not at all. This comes from a place of love, right? And it's just unintentional that it is, when we lead with our trauma without even knowing, right? It can cause harm, but it's from a place of love, meaning I want my children to be safe and protected and cared for, right? So that's our behavior. That's how it's transmitted behaviorally. Biologically, right? You talked about telomeres, right? Do you want to explain what that is? And it's okay if you don't.
Oh, no, you've got this. You're doing great.
Those, so I'm not gonna I'm trying to explain it in the like simplest way possible. Basically, it's parts of a cell that in your genes that show your aging process, right? And so and it shows other few other things, but we know that through trauma, it can age our cells, right? And when we think about one of the most powerful things for generational trauma that stays with me is if we use biologically like female, what is that, anatomy, right? And so if we think about the uterus and the uterine environment, right? A female who has experienced trauma, right, can in her cells will start to change the uterine environment. So her like microbiome environment in her uterus, right? Which then affects her eggs. Okay. So now we have these hundreds of unfertilized eggs, but when they become fertilized, right? So those eggs have already been affected by the trauma in some way. They've been shaped, they've been changed by the trauma. And then if that female, while pregnant and gestating, is also experiencing more trauma, right? Then that growing fetus and their uterine environment and their eggs and their cells and their developing, reproductive system is also being affected. So that trauma is passed down. And I actually do want to clarify because you know what? Not just females have these organs. So I did say females, so I was trying to think of the best way, but I actually want to be respectful of people who are transgender. They seahorse dads, as they're calling themselves, like men can get pregnant. And so I do want to clarify that. Yeah, but that's the way trauma can be transmitted biologically or through genes, at least to one way.
Yes, thank you. That was such a great explanation, and
Come on. It was an explanation for sure.
I mean, look, first of all, I heard about the term birthing parent from you first,
Mhm.
and so I appreciate that you included that part. And yes, I first learned about the ways that these generational traumas can show up in our DNA, and the cool part, how they could be healed, and how
Mhm.
that could show up in our DNA. I
Mhm.
I don't know if you've heard, but like Will Smith's telomeres say that he's like 30 something.
Yes.
I'm
Exactly.
like, "Whoa, that's amazing! Like, that's so hopeful. That's amazing." Right? Okay, so
Exactly.
wait, if we do the stuff that Dr. Nadine Burke Harris says, meditate, do our activities for our parasympathetic nervous system, we could show up looking like that maybe one day? So, there's a lot of hope that
Oh,
through
yeah.
our bodies, we can do some of this healing, which we've talked about in some of our other podcast episodes. Um, but yes. Oh, go
No, I
ahead.
just wanted to say it reminded me of a tweet. So, oh my gosh, her name is Dr. Jen something. If people follow me on Twitter, you can kind of go through the
Mhm.
thread. But she's a neuropsychologist, neuroscientist, and she tweeted something about yes, trauma impacts the brain, right? And like hurts the brain, but when you heal from trauma, you also heal the brain, right? And so I was like, yes. And imagine, right, being in a position to be able to help generations of brains heal, right? And so I
Wow.
tweeted that out because I'm like,
Mhm.
exactly. The one thing I want people to know, if they take away nothing else from today, is that yes, trauma can be passed down from generation to generation, and trauma can be healed, right, in this generation. You don't have to keep perpetuating the cycle, right? And healing and trauma recovery is absolutely possible if we don't wear that trauma as a label.
Hmm.
Because I am finding people doing that more, like feeling empowered and using it as a label. But if you use it as a label, you're partially blocking the healing, right? Because are you going to allow yourself to give up if you're empowered by the idea that you've experienced trauma or that you're traumatized? Because there's two different things, but then are you going to allow yourself to the point of recovery? I don't know. I don't know. I know it may be a little controversial because I know people want to like be empowered by these labels and things that they use, but I have experienced trauma. I am a trauma survivor. I am in recovery.
Right.
I am healing and parts of me are healed, right? And that is empowering too.
So you're bringing up the facts, the data, and your lived experience. And they can't see us, but we're both over here smiling, thinking about how brains, and like you beautifully said, generations of brains can
Mhm,
heal.
mhm,
I'm so
mhm,
happy that from all the things that we've survived as a species, that we're
mhm.
going to be able to come out okay, that things are going to, if people put in,
That part.
right, right,
That
you're like,
part.
wait.
Do the work.
If people
Yes.
do the trauma recovery work, right? Because I love your TikToks on like, wait, time isn't the answer. Time
No.
doesn't heal, right?
Right.
I love that so much. I feel like if I could put that on a shirt or something, if I could just like,
Maybe we should, right?
we should. Right, but I'm just like, I feel really happy and excited. Again, I see both of us smiling right now, thinking
Mhm,
about if folks are putting in that work, then we can see generations of healing, brains and
mhm.
bodies and spirits and all that.
Absolutely, absolutely. I mean, it's one of the reasons why I love when I can do like parent-child work, right? With even with babies, you know me, all the babies, right?
Mhm.
Because like, oh my gosh, we can get this generation super, super early, right? And
Right,
then we can get the grown-up version as well, the grown-up generation as well. And we've helped two generations heal. What? Who wouldn't
right,
love that work? Are you kidding
right.
me? That's amazing.
Well, not everybody does. I think you're
I
like one
mean,
of
I
a
don't
couple perinatal specialists that I know. Yeah,
it's amazing.
yeah.
I don't know. It's just yeah. I don't know. So oh, sorry, you're gonna say something.
No, I was just gonna bring up some of the times where it has been amazing for us, right?
Mhm.
Like, so I remember, and you can, um, you know, share what you feel like sharing, but I can remember so many times where we would bring, trauma consultation cases, and we would talk about the generations, and then sometimes we would get a chance to have multiple generations in the room. And
Mhm.
that is some of the most fulfilling work, like you
Mhm.
said, so I will work with teens and then sometimes children, sometimes adults,
Mhm.
never infants like yourself. You laugh, but you already know that that's not my specialty. So I would be working with somebody and they'll say, "This is a behavioral issue," or "This is," like I used the example in the beginning, "This is a depression that just like won't be touched by our evidence-based approach." And when we actually get to the stories and we learn about what the person has been through, what's happened to the person, it was so fulfilling to see. First of all, this isn't a behavioral thing. This isn't a depression. This is the person's trauma showing up in this way, and the ways
Mhm.
that that person is protecting from those traumas, or the residual protections left from the traumas. And then we get a chance sometimes to work with, the person's caregiver or aunt, or, and then we get a chance to kind of transform some of that generational trauma and the ways that that shows up. And that's some of the most powerful stuff. Yeah.
Absolutely, absolutely. I mean, so many thoughts came to my mind, but you're right. It's those times where so I'm gonna use kind of thinking about I know I have two examples in my head. Let me try to
Mhm.
parse this out. So if we look at children, right? And so as you know, that one of the areas that I'm trained in is play therapy. Play therapy as their institution, the one that's based in the US, they kind of look at from ages 3 to about 17 using play therapy, although there have been studies on play therapy from infancy through like age 90.
Mhm.
um, but when most people think of play therapy, they think of individual, the therapist alone in the room with the child patient, child client, and helping that child process. A lot of times it's trauma, right? A lot of times play therapy is used with trauma cases. And that's great and it has its purpose and it has its place. But as you know, because of one of my training experiences, several of my training experiences and having a school psych background, I actually look at children in a conceptual model of a family, right? And it doesn't matter what that family looks like or what the components of that family are, but children, even if they are in the foster care system, typically come with an adult, right? And so how that adult functions helps me understand what's happening with the child, right? And so kind of thinking about cases where you get someone and they're like, this child has all these behavioral problems and they've been through this thing and there's this trauma that they've experienced, but like they should just be over it by now, or can you please help? And yeah, I'm going to meet with the child alone, but very often I'm also going to meet with the parent alone, and I want to see the parent and child, or the caregiver and child together.
Mhm. Mhm.
People will be blown away by some of the things that I reveal or that I learn about a family, about a child's presentation based on my alone time with the parent. Because very often there is some type of unresolved trauma in the parent's background that is having this influence on the child's present behaviors. So yes, the child has some problematic behaviors, but they're not the behaviors aren't the root of it. That's, why are the behaviors happening is the question we're always trying to answer. What is going
Mhm.
on that these behaviors are showing up? Because behaviors are usually, they start off as adaptive, like it's serving some function. And then we're like, oh, they're still doing the same behavior, but in a different environment. So now it's not serving the same function. But learning that a parent has unresolved trauma. Okay. All right. So now we can look at this case as a parent-child case, right? Because we need you to do some healing. We need parent, caregiver to do some healing.
That's a lot to chew on.
And it's a lot to chew
Mhm.
on and
Mhm.
chew
They
away.
came in for
Right?
anxiety, and now
Yes.
we're telling them, "Wait, go back a generation. Go back a few if you can." Yeah.
You're right. You're right. It's shocking for people.
Mhm.
And though there are also times where people are like, oh, wow, I get to be involved in my child's therapy. I didn't know that was
A lot of
possible.
times like that. Mhm.
Yeah, I didn't even know I could do that. Right.
Mm.
Or, I mean, just think about, because right, when it's the child in individual therapy, there's so much that we don't tell parents because we're trying to be confidential with the child's space and process, their abilities to process.
Mhm.
But if they're both in the room, right, if we're giving opportunities for them to process together, to heal together, right, then the only thing that's being confidential, right, is the information to the outside world. So that the parent then can see and understand where the child is coming from in real time. But I think those are super fun, and I was just like, wow, those are the ones that do make me think like, I wonder what a different approach from the last therapist would have, how that might have changed, or how that
Mhm.
might have like helped support you earlier, or those sorts of things. So not to blame the other person, but just like I wonder, right? My wondering. Um, yeah. I have another example, but I want you to be able to like chime in here. I don't want to take up all the
Well,
space.
yeah, I'm just right there with you as far as, like, feeling a little bit curious about what if we wouldn't have just focused on, like, for example, um, you remembering your backpack, you remembering your homework, you know, whatever behaviors show up in school, right? And which I get it, that gets you in the door. That gets you the things that you needed to be able to come to us, and then we get
Mhm.
a chance to, like, maybe look at it a little bit differently. Maybe get a
Mhm.
chance to see what the child has seen, what's happened to them, what they've survived, and then so on and so forth through the generations.
Yeah.
Mhm.
Absolutely. And then you talked about before, excuse me, where, people will come in with, I think these are they're funny to us as therapists, right? But people will come and they'll say, yeah, I'm really struggling with work, right? I'm having, anxiety attacks, about work. And that's all I want to work on. And I'm fine. My life has been fine. My upbringing is fine. I don't have any trauma. Everything's fine. And then we have them do, earlier you said, or I think in the previous episode, you might have talked about ACE. So adverse childhood experiences score. So we'll look at trauma or adverse experiences they've experienced from birth to age 18. And then I think we both do an adult one too, an adult trauma scale. to see what that looks like. But they'll do that, and they've like identified 5, 6, 7, 8, 9 things. You're like, oh, they're not even registering that could be a trauma for them. But they'll come in with this like work issue, and then you'll learn all of these things in their history, the ways that they were parented that could be really harmful. And you're like, oh, okay. So these anxiety attacks at work don't really have anything to do with work. Yes, work is reminding your body, your cells,
Mhm.
right, of this previously lived experience or trauma, or reminding you of how you were treated in your upbringing because of how your parents were treated in their upbringing, and so on and so on and so on. So we need to go back and heal that stuff
Mhm.
in order for these anxiety attacks at work to go away.
Yes. Yes, yes, and yes. Sometimes people will get sick of me because they'll be like, "Okay, like, I came to you for this panic attack, and now you opened up this whole other area." And they'll still come back. They'll know that, but
Mhm.
here I am reflecting and mirroring something for them that they didn't know was a thing. And so that could be hard to, again, like I said, chew on. It could be really hard to digest that, yes, maybe you grew up with X, Y, or Z supports or resources, and maybe you didn't have access to this other component of nurturing that you needed, or
Mhm.
maybe you didn't get all that you needed from society or from a caregiver. And how can we look at that in a really non-blameful way? Because
Mhm.
a lot of times folks will say, "Hey, listen, you're touching something, and I want you to know that is absolutely true. And my mom and I have a great relationship now."
Mhm.
And so I'm like, "Yeah, we're never going to be in here talking negatively about a caregiver or something like that. What we are gonna do is take a really non-shameful, non-blameful look at what happened, and
Mhm.
then we get a chance to have this expansive compassion for what happened to them too,
Mhm.
and, kinda going back,
Mhm.
throughout the generations, again, that generational trauma, and then we get a more and what I found is a more connected, more present, more honest generational connection.
Yeah. I'm gonna say that that's hard. What you've brought up is something that is very common, where people are first of all, you said that it can be hard to chew on and difficult, and absolutely, it's scary.
Mhm.
You've opened up this unknown, right? I was walking through my life blissfully thinking that it's just work trauma,
Yep.
and you're telling me that something that happened to me when I was 4 years old, or the fact that what in the world? Like, how do I deal with that, right? So,
Mhm.
absolutely, it is scary. Um, and so we have to hold space for that too. But that other piece, I like the way you said it. I don't think I say that in that way, but you're like, we're not, when they're worried about ruining their relationship that they have with the caregiver in the present, because we're going back to understanding the caregiver that they had in the past. And you said, we're not going to be in here talking negatively about that person. I think that's beautiful because I don't know if I definitely don't say that. And I'm like, do I believe that? Like, do we sometimes talk negatively about that parent? Yes. And I still try to help them hold compassion that
Mm.
they did
Mhm.
that. But sometimes what I want them to do is I want their little self, their younger self, to voice what they needed to voice, to express what they needed to express. And sometimes that might be, mommy, you weren't there for me.
Mhm.
Dad, how could you do that to me or say that to me or leave me? How parents, grandparents, auntie, how could you not protect me? Right? Sometimes that we need them to voice that, to be able to hear that from themselves. And I do say that this isn't to erase the beautiful relationship that you have with your parent. This isn't you don't have to go to them and address these things directly with them. But if your younger self needs to be able to say those
Mhm.
things, we need to hold space. So, one of the things that I do tell people is let's put it out in the open right now how much you love this person who did this thing to you or who didn't
Right.
show up for you. Let's say it. Let's say you love them. Let's talk about all the great things about them. And I do that and I tell them why. I said, I want us to do this because you're going to have this urge every single time a hard thing comes up, you're going to want to say but she was really there for me, or but there were these times where he did this, and you're
Or
going to
they
bring
tried
those
their
in.
best or
And I just say, I know that, and we will get to, like, I already know. I want you to know that I know how much you love them. I know how special they are. I know all those things. And in this space, right? And I know I also talk about, especially working with people of color, Black people specifically, we have this, our parents are on pedestals. Our parents are almost spiritual, godly, like you don't say negative things about them. You hold them with such high esteem and respect. And so it feels viscerally wrong to say negative things out loud. You can think what you need to think, but out loud to someone else that's not even family, right? And so you have this, like, I can't say that. I'm not able to say that's not okay. I have to then follow up with how strong, great, all the sacrifices that they made. I'm here because of them. I have to. And I will say, I know culturally that's what it's telling you to do, but right in this space, this is the one space we don't have to do that, right? Not right now, because we can build the compassion back up if we need to for them, right? As you talked about that beautiful, like looking at the layers of compassion and what they went through. Absolutely. But when we start there, this is how I look at trauma. When we start there, what are we doing to younger you? We're essentially gaslighting younger you to say, because of these layers, what happened to you didn't matter. Right? And so I want them to know, yes, these layers are so important. But for now, our focus is what happened to you. You are the most important thing in this room right now. That is what we need to hold on to. That is what we need to help you resolve. And then we'll make room and space. And I would say that's probably the hardest piece. I think that is because people will be like, well, why do I have to do that? Because it's that barrier. Why do I have to like dredge up what was hard if I'm okay now? And then we kind of go back to, but are you okay now?
Right. So they came in for work stuff or whatever, right? Like, here's the way that my fear of authority figure shows up at, in my relationship or
Right.
whatever, right? So they come in for this. And then here we are validating their little one and what they've been through. And hopefully, like you said, a way that's going to unify their inner story and unify like the ways that they feel, help them feel heard. And you're right, it's not like negative or not negative. It's I love what you said. It's not about that. It's about helping them feel heard and not doing it in a way like, oh yeah, she sucked and blah blah blah, right? Like we're not doing that. You can go to like a neighbor for that, which is fine, but that's not what we're talking about. So when somebody is validated and heard in that way, I do feel like there's a lot of space and possibility for the ways that they can get their initial question answered about the relationship or work or whatever, right? Because then they're like showing up in this whole other way in their life where that fear of authority isn't um, silencing them in their relationship or is allowing them to just be their authentic self at work or whatever kind of they came in with.
Absolutely. Absolutely. I also just want to say that I want people to know, I want listeners to know that, especially with trauma, it happens regardless in therapy, but especially with trauma, sometimes your symptoms get a little worse or a lot worse right before they get better.
Yeah.
And it's because we might be dredging up this traumatic experience or these traumatic experiences that you have either purposely or inadvertently tried to push away and not address. And now here it is all at the surface, right? And that is uncomfortable, that it's painful, it can be ugly, right? And if you continue with that work, healing is on the horizon. That is my take. That is a takeaway that I want people to have. Like, because so often people pause there. They pause when it's hard. They stop. They give up. You're a horrible therapist, or I'm never going to do this again, or you're going to make me all those things. And it's like, just hang in a little bit longer, right? You're almost at the goal mine. Like, you're almost there. But yeah, Generational trauma is, as you said at the beginning, something that makes us smile because we can be helping people heal generations. And it's hard work on everybody's part. It's not easy for anybody.
Yeah, and I'm really happy that you brought up the, it can, for some people, get worse before it gets better too, because, I like to think of it as physical therapy or something, right? So
Mhm.
I'm doing my physical therapy for my hip pain, and my PT, my physical therapist, wants me to get that area pretty much buff so that it doesn't hurt so much, right?
Mhm.
And in that meantime, as I'm getting that area strengthened and strong, it hurts. And I'm
Yep.
having to do a lot of stretches. So I'm literally stretching, growing, strengthening this area so that I can reduce my pain later. So it's like,
Yep.
wait, pain
Uh-huh.
to get less pain. What?
Yep. Uh-huh. Growing pains. We were talking about this the other day.
You
Absolutely.
were.
We were. Because
Mhm.
I remember physical growing pains. I don't know if you
Mhm.
had this, but
Mhm.
I've been the same height. I'm pretty much 5'8". And I've
Mhm.
been this height since I was like 10 or 11 years old. So I had like a growth spurt and then I, stopped shortly thereafter. And because of that, my knees and my elbows, my joints, because they were grown, my bones, I would tell my mom, my bones hurt.
Oh,
Like I remember back then, I think
yeah.
now there's like icy hot, but I remember like I was like, I want Ben Gay because I'd seen commercials. I was like, I
Mhm.
need Ben Gay because it was like for your bones and your joints. And I was
Oh,
like, but it hurt so bad to grow.
right.
Trauma is like that. Healing is like that.
Mhm.
Beautiful example you gave with PT, right? It doesn't feel good, it doesn't feel comfortable, it hurts. In the long run, it will feel better.
Mhm.
You'll be out there jogging or whatever you need to do with your hips. Um, and you'll be better for it. Um,
Mhm.
in the meantime, though, it's super painful. It can be painful. Yeah.
So, and as far as for me, unless there's something more, I'll just be cheesy as we exit for today. Let's
Oh
stretch
gosh.
in, right? You already know where this is
I
going.
don't know. Your cheesiness, let's see.
Let's stretch into those growth pains,
Got
and
it.
we'll definitely see you through that. Yeah.
Yeah.
Mhm.
Yep. And stretch into them and know that you can ground yourself afterwards. Right?
That's right.
There you go. All right. This has been a great talk. I think it probably went a little long today, but I really enjoyed this. And again, if you have questions, if you want to learn more about this, you can find us on our different social media accounts. But then also, you'll be able to call in soon with questions. So we're going to be setting that up.
Oh,
It's been really
great.
exciting talking to you, Dr. Doherty. Can't wait till next week.
Same here, Dr. Dalton. This was great.
All
See you
right.
again.
See you soon. Bye-bye.
Bye. If you are looking for a therapist for yourself or your child, you can visit our websites, playfullypsych.com or softheartpsychology.com.
We appreciate you joining us this week and can't wait till there's another opportunity to jump on the couch with you next week.